My name is Dr. Beth Beaudin-Seiler, and I'm the Director of the Healthcare Value Hub at Altarum. The Healthcare Value Hub is a technical assistance and research center that supports consumer advocacy organizations that are working at the state level to advance policies that make the healthcare system more equitable, more affordable, and more patient-centered. I'm here today to share some of the results of a recent survey that we conducted highlighting New Jersey respondents' views on healthcare affordability issues and support for solutions. I'm going to talk today about the findings from our Consumer Healthcare Experience State Survey, which we call CHESS. But first, I'll say a few things about the survey instrument itself. The survey used a demographically balanced web-based panel of roughly 1,100 New Jersey adults ages 18 and older to gather information on respondents' healthcare experiences and opinions. We fielded the survey from October 2nd to October 24th, 2022. The survey was conducted in both English and Spanish on a variety of affordability topics. So let's talk about what we learned. The data showed us that over 57% of New Jersey respondents reported having one or more healthcare affordability burden in the past year. We define healthcare affordability burden as having experienced any of these three components. Respondents who have said yes, they were uninsured either all or part of the past year, and the reason was the high cost of health insurance. Respondents who said they delayed or went without care or rationed medications due to cost. And respondents who said they got care but struggled to pay the resulting medical bills. Let's first talk about the going without care due to cost component. It includes things like skipping needed dental care, avoiding going to the doctor altogether, cutting pills in half, skipping doses of medicine or not filling a prescription, skipping a recommended medical test or treatment, problems getting mental health care or addiction treatment care, or skipping or delaying getting a medical assisted device. We see that 49% of New Jersey respondents reported having done at least one of these things in the past year due to cost. We also asked New Jersey respondents about other barriers that may have been the reason why someone in their household did not get needed medical care in the past year. And cost was cited most often as the reason, exceeding other barriers like getting time off of work, transportation, couldn't get an appointment, or lack of childcare. It's important to recognize that healthcare affordability problems aren't just experienced by low-income earners. They go far up the income stream, with nearly half of the respondents with household incomes of $100,000 per year or more who reported facing one or more of the affordability components in this past year. Still, New Jersey residents earning less than $50,000 per year face the greatest burden, with 68% reporting one or more of these healthcare affordability problems. This pattern of lower income groups experiencing higher rates of overall affordability burdens holds true as we look specifically at foregoing or delaying a variety of healthcare services and rationing medication. But still, the data shows respondents in all income groups experience going without care and rationing medication due to cost. We also examined affordability burdens by insurance type and found that those with New Jersey Medicaid, the state's coverage for low-income people, and those with private insurance, either through their employer or insurance that they've purchased on their own, reported the highest rates of going without care due to cost, 58% and 49% respectively. Looking at open-ended text responses, we found that some respondents with New Jersey Medicaid reported difficulty accessing certain services, or that certain services were not covered by their insurance, including dental services, such as oral surgery and braces, as well as mental health visits and substance use services, among other things. For example, one respondent said, "I went to the dentist and I needed pain medicine, but insurance didn't help at that time, so I paid the $155 from asking family members." Another responded, "I'm on medication-assisted treatment for addiction and can't find a doctor to take my Medicaid, which forces me to pay $120 monthly to see my doctor for my medication." In addition, Some respondents expressed confusion and uncertainty over which services were covered by Medicaid and didn't want to take the chance of an out-of-pocket cost. While the sample sizes in the open-ended text were too small to report, these affordability challenges are worth noting. Regional variations show that while affordability burdens are high in all areas of the state, residents in North New Jersey reported slightly higher rates of healthcare affordability burdens at 51%. The survey also found that respondents of color reported higher rates of going without care due to cost compared to white respondents. We want to acknowledge that the group comprising American Indian respondents, Asian respondents, and Native Hawaiian or other Pacific Islander respondents reported higher rates of foregoing care and rationing medication due to cost compared to white respondents. However, it's important to note that these three groups within this category were combined due to small sample sizes, and the experiences that they have experiencing affordability burdens are not necessarily uniform. Across the board, respondents of color reported higher rates of foregoing specific types of care. For example, Black African American respondents reported the highest rate of skipping needed dental care and the highest rates of rationing medication. Likewise, the survey also revealed differences in affordability burdens by ethnicity. Hispanic respondents reported higher rates of each specific affordability burden than non-Hispanic respondents. Finally, the survey found that respondents who had a disability or lived with someone with a disability reported going without care and rationing medication due to cost at far greater rates than households without any disabled members. Beyond rationing medication, New Jersey respondents who have a disability or live with a person with a disability more frequently reported a diverse array of affordability burdens compared to households that do not include a person with at least one disability. Now let's talk about the struggle to pay for medical bills component of affordability burdens. As we noted earlier, affordability burdens reflect not only the challenges in obtaining medical care, but even when respondents did get that care, greater than 1 in 3 struggled to pay their medical bill. Financial hardships due to medical bills included using up all or most of their savings, being unable to pay for basic necessities like food, heat, or housing, and going into debt, among other things. We examined further with respondents who reported financial hardship due to their medical bills, and the data shows very similar results as the foregoing care component. Black African American respondents reported higher rates of financial hardship due to medical bills compared to white respondents. Hispanic respondents reported higher rates of financial hardship due to medical bills compared to non-Hispanic respondents, and 58% of respondents living in households with a person with a disability reported a financial burden compared to just 28% of those without a disabled household member. Given these experiences, it's not surprising that many respondents are concerned about healthcare costs in the future. 85% are worried or very worried about affording some aspect of healthcare in the future. And while two of the most common worries, affording the cost of nursing home or home care services and medical costs when elderly, are really applicable predominantly to the older population, they were most frequently reported by respondents aged 25 to 54. This finding suggests that New Jersey respondents may be worried about affording the cost of care for both aging parents and themselves. In light of these healthcare affordability burdens and concerns, it's not surprising that 73% of New Jersey respondents believe that the healthcare system needs to change. 44% said that healthcare should be a top priority for elected officials, and 49% said they should address high healthcare costs, including prescription drug costs. When given more than 20 options, New Jersey respondents most frequently said that the major reasons for high healthcare costs were hospitals, drug companies, and insurance companies charging too much money. At the same time, They reported seeing the government as a key stakeholder that needs to act to address health system problems. The data show that New Jersey respondents of different political parties support a wide variety of actionable strategies that they think law policymakers should pursue. And the data show that there is a bipartisan support for these policies. There's also a notable amount of bipartisan support for other policies shown here. And that concludes the information that I have for you today, but I encourage each of you to view our additional findings in the reports and reach out if you have any questions. Thanks for your time.